Hey, this is Paul, and 4 days after my partial knee replacement surgery, thought I'd give everybody a quick update. So, if you watched my other videos, day 2 was definitely the hardest. You know, day 1, you had your surgery, they had a lot of painkillers actually in the knee, so you felt pretty darn good. Day 2 is the most painful for me. Day 3 was a little better, and day 4 now is even better. So I think hopefully now we're all going this way, which is fantastic. So for those of you that are going to get the surgery or thinking about it, that day 2 is definitely the time period that you're going to really feel it. So what else? So I had my traditional, my rehab. I went to the center yesterday, and we pretty much did the same thing that we did on the first rehab day at the rehab center. So that was a lot of stretching. You want to make sure that you are getting, you're getting be able to put your legs straight here, and also being able to bend it. So those are the things you kind of work on. They didn't really add a lot, because I think the first week they just want to make sure that you're continuing your stretching and keeping things limber and moving. You know, they put me on the bike, but I'd already been doing it here. So not much changes. So the one thing that is kind of not a revelation to me, but it's definitely a little bit of a cheat code, I think, is, hey, I can walk around right now and I feel fine. But if I walk too much, I'm gonna get sore. And when I get sore, then I will get more swollen here. And when you're swollen, not only is it irritable and not only does it hurt, but then you cannot do your exercise as well. So it's really hard to stretch, it's really hard to move your knee when it's so swollen. So while I could probably walk down my driveway and maybe back, that's doing nothing for me rehab-wise. So I have really been staying on the crutches when I'm walking around the house, and then keep the inflammation down, ice a lot, and with the inflammation down, it's just a lot easier to do the stretches, to get on the bike, to get moving around, and then after that, ice again. So kind of my cheat code, kind of my aha moment was, yeah, you could walk, but really it's doing nothing for getting back out there by just walking around. It's actually hurting you a little bit. Just stay off of it, just be gentle with it. Keep the pounding of the knee to a minimum, so to speak, so that it doesn't get swollen, or keep the swelling down. And when you feel that, when it is that way, it's so much easier to do all your rehab exercises. So that's day 4, and bigger and better things, hopefully, and I'll be back to you with updates probably tomorrow.